the festive mood from December to early January is already in full swing, and with this, a lot of alcohol drinking and in some cases binging. The results are most of the time often unpleasant, to say the least. At the end of the season, many lives are impacted by the obsessive use of booze and related substances. Some effects are permanent. This year, as part of its campaign to raise awareness about the abuse of alcohol, Tea with Anele Ndlovu, a mental advocacy and women empowerment initiative, observes 11 days from December the 1st to the 11th to raise awareness on the relationship between alcoholism and mental health. An alcoholic in recovery herself, Anele Ndlovu, joins us to share her thoughts and experiences. Anele, a very good evening to you. We appreciate the time that you've taken to speak to us. How did this initiative come about?
Hi, good evening. Thank you so much for having me. So this initiative started just from my own experience with alcoholism and how it's impacted on my life, how it's impacted on my mental as well as my physical health. And I just thought there are so many people who have been in denial, like I have been for years, for months, who may need the awareness, or there's someone in their families who are suffering from alcoholism but may not be aware of it. And I just thought, let me use this time. Every month, as a group and organization, we focus on a social issue that impacts on mental health. And I just thought, with the festive season starting, with people wrapping up the year, and also getting into the new year, just to make people aware of the effects of alcohol, what alcoholism is, and how it impacts on our mental and physical well-being.
So, as you know, there was a long thread at some point discussing a local celebrity, whether or not she is an alcoholic, based on the amount that she consumed at the time. The discussion was over the fact that it's just a bottle of wine. What pushed you to the point to say, I'm an alcoholic and I need help?
So interestingly, what I've also discovered in being in this journey of recovery and accepting my alcoholism is there are people who can drink that bottle of wine or whatever it is, and they can stop and they are fine, and the next day they don't have to drink, the next week, the next month, or whatever it is. But with me, I became excessive in my drinking and I couldn't stop anymore, and I didn't know my limits anymore. And it was like my body, my brain, everything is craving a drink. And that's how you can differentiate between a moderate drinker and excessive drinker who is then an alcoholic. It's how your body responds to your alcohol intake, and it's how much alcohol you can take and if you can stop. You know, I made an example in a video that I shared on my social media and to my networks, that there are people who can say, I've had enough for the evening or for the week or for the month, or even take a year off alcohol. And then there are people like me who got to a point where I could do that, but then I couldn't anymore. It was like I needed to drink. So that's how I've been able to differentiate between moderate drinking and excessive drinking, and how it is that you become an alcoholic. Because it's like being on drugs, you know, you have to have this in your system and you can't go a day without it, and you find ways and means just to get that fix, if I can call it that.
It's interesting to hear you say that feeling of you have to have it. And it seems like a lot of people around the festive season feel like they have to have alcohol when they hang out with their friends, with their family, with their co-workers, and it's a festive mood. Like, there is no festivities without alcohol. How do you say to people that this is what's healthy, but this is where it stops being healthy?
Yeah, it's very interesting that you asked me that question, because when I posted about the awareness that I'm going to be doing these first 2 weeks of December, a lot of people were just like, why don't you do this in January? And I'm like, this is actually the perfect time, because you can actually check with yourself as you're drinking. Am I drinking sociably? Am I drinking responsibly? Or do I not know when to stop? And as people take time off work, you can then kind of take this time to say, maybe I do drink more than I should. And I have this time just to check in with myself before the year starts. Because what I've also found is the more pressure there is and the more stresses there are, a lot of us tend to drink so that we can not feel those emotions and not feel. And a lot of people will drink because it's fun and it's relaxing and it's the festive season, great. But then there are those who are going to drink because the festive season is actually a stressful time for them. Their families are expecting them to do all these things, spend money, and so to run away from their problems. And that's another thing, that if you drink so that you don't face a challenge or a situation or a problem that you're facing, then you're not drinking socially, you're not drinking to have fun, you're not drinking to relax. That's another way to check yourself. Why is it that I'm drinking? And if I'm drinking, which I also found with myself, is I didn't know how to sip slowly and just enjoy the drink. It was like, you need to just gulp your drink so that you drink more and you get this sensation of, I'm not feeling any emotions anymore. So that's another way of being able to check yourself. And yourself, you can feel that I'm getting a bit lightheaded, or my stomach hurts or something, or I'm slurring in my speech. Yeah.
As you say, abuse of alcohol and related substances, as you're speaking, I'm thinking that it sounds very much like drug addicts, how they explain it, that, it's about getting to a particular feeling. So are these the kind of messages that you share with people, that when it starts interfering with your responsibilities, when it starts interfering with how you interact with people, how are you carrying out that byline, hashtag the tea with Anele? And I'm also curious, is it a play on, popular cultural term, the tea, as in we're going to lay it down for you, this is, what actually happens at the end of the story if it's not a good one for you?
I'm so glad you got that, because a lot of people are like, why the tea, But it definitely is a catch on and a play on those words, like, let's talk about it, let's break it down, let's gossip a bit. And every month, like I said, we focus on a certain topic. So let's actually break down suicide. Let's break down men's mental health. Let's break down relationships and mental health. So with this awareness, it's saying these are the signs that you should look at in terms of your drinking habits or the drinking habits of people around you. And this is how you can get help. So with the tea with Anele Ndlovu, it's not just about creating the awareness. Some people don't know where to go to get help. So we're creating awareness on this social ill, on this social issue. But then you can go to these kind of platforms, or you can go to this organization, or you can go to this hospital, or contact this counselor. So with the alcoholism, it's also maybe you need rehab. I think I'm blessed, and a lot of people that I've interacted with, especially with, I'm part of the Alcoholics Anonymous Fellowship, and a lot of the people in our group and in AA have had to go to rehab for their treatments and their recovery. But I haven't had to, I think, even though it was far down the line, I think my drinking habits and the excessiveness of it, but I've been able to,
Sorry, I'm sorry to jump in there, and you can complete your sentence after this, because we have run out of time. But it's a very important question. I'd imagine that a lot of people, there's a sense of shame in admitting it. Some might want to even do it anonymously. How do people get access to these services, and actually also understand that there is no shame in admitting how you are interacting with alcohol and its impact on you? Because You know, in the society that we live in, people see it as cool, your ability to drink and to drink countless amounts of alcohol.
Yes. It really, really is a cool thing, and you're part of the club and all that. But it's not. It really isn't cool, especially if you don't know your limits. And for me, and the reason why I'm speaking so openly about it is to show people, because just like with mental health and mental illnesses, there's a certain picture that we have of someone who's an alcoholic. There are people who are like, we would have never thought that you were an alcoholic, you know. And so for me, it's being able to take away that shame and that stigma to say, look at me, look at the kind of family that I come from, look at the kind of career that I've had, the work I'm doing now, but this is my reality, you know. And with being like, for me, being part of AA, it was a matter of, I Googled, I phoned the nearest area to me. You know, I asked about the meetings. They do have a schedule online. There are online meetings, there are in-person meetings. But also it's going to institutions and organizations like the South African Depression and Anxiety Group, Lifeline, seeing your therapist, your psychologist, going into any mental health institute that is close to you. They do help with addiction. There are rehab centers that you can reach out to. And if you really feel that you can't talk to someone, you don't have to tell people about it. But if you can sense that there is a bit of a problem or the problem is starting, please just go anonymously. The best part about AA is it's driven that whatever happens in the rooms stays in the rooms. Even if you see someone in a shopping center, you cannot say anything because it's such a vulnerable topic and situation for someone.
Thank you so much for sharing with us this very important discussion and also your own personal journey. Anele Ndlovu, she is a mental health advocate. She is running this awareness campaign, the Tea with Anele Ndlovu. So it raises awareness on alcoholism and mental health, but also the festive season, how we really let loose and stop engaging with rationale on what our limits are and endangering ourselves and others, of course.